Hello, everyone. Thank you for attending our Recovery Housing RFP webinar, Improving Availability and Quality of Recovery Housing. Interact for Health promotes health equity to improve the health of all people in our region. We do this through grants, education, research, policy, and engagement. Our teams are currently operating under 3 different pillars of funding. The first is reducing tobacco use, supporting school-based health centers, and addressing the opioid epidemic. This is Interact for Health service area. So these are the counties that we help support and do funding in. As you'll see, it's the greater Cincinnati region, which includes Southwest Ohio, Northern Kentucky, and Southeastern Indiana. This is the opioid team. We have Sonia Carrico, our team lead and senior program officer, Michelle Leidenberg, our evaluation officer, and myself, Lisa Myers, program officer.
Lisa, thank you for that great introduction. We'll go ahead and dive right into the key components of the RFP that we will be releasing today. The goal for our opioid team is to reverse the trend of overdoses and deaths from opioids. And we've established 3 strategies to do that: reducing overdose deaths, connecting people in crisis to care, and reducing overdose and relapse, which is what we're talking about today through recovery support. And of course, you'll see there at the bottom that we have a very broad strategy that encompasses all of those 3 areas where we're very invested in data identification and using and improving data in our region, enhancing technology, and reducing stigma. The goal for this RFP is to be able to increase the availability and quality of recovery housing for persons with opioid use disorder in our region. Some examples of funding can be supporting capital projects, improving access to services such as telehealth or transportation to attend treatment services, preparing your recovery house for NAR or state certification, and supporting the planning and creation of a business plan for a new recovery house. As we jump into this RFP, we do want to go over some definitions that you will find throughout the document. When we discuss NAR, we are referring to the National Association of Recovery Residences that was founded in 2011. NAR has developed 4 levels of recovery housing based on the level of services that are being offered. So you'll see here that level 1 is strictly peer run. There are no paid employees on staff within this particular house. Level 2 is monitored by a house manager. This person is often somebody that was a resident of the house and moved into a leadership position, but is always somebody with lived experience in most cases. Level 3 is where we start to get into services that need to be provided by a licensed or certified clinician. So we're looking at some level of professional care. It could be a counselor that's coming in and doing some groups on a periodic basis. And level 4 is an area that is considered residential treatment or a therapeutic community and is run by licensed professionals on staff. We will not be funding level 4 housing under this RFP because level 4 is considered residential treatment in our 3 states and does have to go through your respective state licensing and certification process. The overview for our RFP, again, is to reduce overdoses and overdose deaths. We want to support our community partners with a comprehensive approach that includes recovery support systems. Proposed projects will include not only the number of beds, but we are very interested in helping improve the quality of existing recovery houses, as well as bed expansion in areas where houses don't currently exist or there's a greater need. We will ask that you identify if you will be seeking a planning or an implementation grant. Often our planning grants involve a large collaborative work group who's doing a data assessment of the community, identifying needs based on data, and really working through that business plan of, are you procuring a house? Are you procuring land to build a house? And what does that process look like to get you to that stage of opening your recovery house or implementing your recovery house program. An implementation grant should include costs to support capacity expansion. So you would have an existing recovery house that is seeking to do an addition, maybe to add 2 or 3 beds to your house. New programs or services to access community-based needs. So again, how are people accessing employment? Do you need technology to complete resumes? Do you need technology to incorporate some telehealth? Do you need additional funds for bus passes so that people can get to community-based services? You'll see that we have a rather extensive list of what you can do as an implementation grantee, but we will go over them quickly. You will need to identify the populations that you are going to serve, so be it male, female, women, and children. Men with their children, we want to know exactly who your population is. And we want to hear any exclusions for admission. So are you a faith-based organization that would exclude certain individuals? So for example, maybe you don't support medication-assisted treatment. You're an abstinence-only organization. Or it's not unrealistic to think that some people with certain felony offenses or criminal backgrounds would not be appropriate for admission to your home. So if there are sex offenses that are not appropriate or other things, we want to know what those exclusions are. We do want to be sure that there's a level of habitability, which means that we want to support houses that have running water, that have electricity, that the kitchen appliances work. The 3 states that we support, Kentucky, Ohio, and Indiana, are not on level playing fields when we talk about certifications, processes, and expectations. So this is one way that we are really trying to make sure that we're setting a baseline for quality of recovery housing across our region. We do want to see a copy of your landlord-tenant contract. There are landlord-tenant laws that apply and exist in Ohio and Indiana. There are some other laws that exist in Kentucky that are not landlord-tenant related. So if you don't have a landlord-tenant contract, please note that as well. We want to see a copy of your residence agreement or any document that outlines some type of specific program participation. So do you require your residents to attend a certain number of AA or NA or other support meetings on a weekly basis? Do you expect them to help with any of the day-to-day household chores? Do you expect them to have employment by a certain period of time? Those are the things that we want to see in your residence agreement. If you are certified, that's wonderful, and we would like for you to submit a copy of certification if you are in Ohio or Indiana. You can also have national certification through the NARS in Kentucky, even though you don't have state certification. So you may not be certified in your state, but you did go through the NARS certification process. So if that's applicable, please include that as well. And then everybody, we hope, has a copy of an application for admission. So we want to know who you're looking for, what your clientele looks like, and again, going back to that who are we serving aspect of the process. And then, of course, we want to finally ask you to define your recovery housing level. As I mentioned, the levels 1 through 3 earlier. We want to know, you don't have to be certified, we just want to know where your house falls in those levels.
Great, thanks, Sonia. So looking at proposal selection criteria, so what are we looking for? The most competitive applicants will demonstrate the need for recovery housing in your community using best available, relevant local data to demonstrate that need. Demonstrate the capability and capacity of your organization to provide those services. Describe how you are currently or plan to implement the NAR standards. Include newer innovative approaches to providing or expanding recovery housing services. Describe whether it's planning or implementation, so planning of a new program or adding bed capacity or expanding an existing program. Additionally, the most competitive applicants will describe housing needs to complete NARS or state certification process. So if there are particular needs to meet those standards, Additionally, we'll detail a realistic timeline, include a description of any matching or in-kind contributions from the lead organization or any partner organizations. It will also include a plan for sustainability after grant funding is over. We'll also include a clear plan for evaluation, which we'll talk more about in just one moment. And then we'll also demonstrate your ability to implement and or plan this project while also recognizing that we're still in the middle of a pandemic. So making sure that this project is still reasonable and feasible given all the craziness of COVID. Capacity related experience. So as we mentioned in the proposal selection criteria, we're looking for organizations that can demonstrate their capability to provide the proposed activities and services, describe any experience delivering similar types of programs. And for planning grants, applicants will need to demonstrate their capacity to create a plan and experience with this type of planning. So we have a total of $400,000 available for projects in this RFP. We anticipate that planning grants will not exceed 12 months and $25,000. For implementation grants, we anticipate the grants will last a little longer, 12 to 36 months. And grant period as well as amount should just be reasonable to the proposed project and the proposed project's goals. We do have some grantee requirements that we wanted to be sure to share with you before you apply. So grantees are expected to work with Interact for Health to develop an evaluation plan in partnership with me, the evaluation officer, for this body of work. And we expect to have that completed within 60 days after the grant is awarded. And you know, the evaluation plan is really meant to help demonstrate the impact of your project as well as create a kind of a template for any similar projects who might be interested in doing something like yours. So next, looking at goals and outcomes, this is a newer piece, so I just wanted to take a moment and go over the goals and outcomes section. We have included this outcomes chart in our application process. Previously, this was more of the evaluation planning process. But so what we're looking for here is for grantees to take a stab at identifying the outcomes that you anticipate that you will achieve with your project. And we're looking for 3 to 5 potential outcomes. And all we're asking is for you to think about what change you hope to see, how you'll measure it, how you'll collect that data, a potential timeline, the person who would be responsible for collecting that data, if you have any baseline data, and if not, if it's a totally new project, that's okay too. And then your target, what do you hope to accomplish with your proposed project? So if you have any questions as you start to fill out this form, please feel free to reach out to me. My email is listed here. You can also reach out to Sonia and she can connect you to me as well. I'm happy to brainstorm potential outcomes and data collection methods. We've also included in that outcomes form some potential, just some ideas for potential outcomes that, you know, things that we personally are interested in or are tracking ourselves. So again, please feel free to reach out if you have any questions as you complete this form. And next, we are going to talk a little bit about Found It, which is our online grants management system, and it's newer to Interact for Health. So I'm going to hopefully link to a YouTube video from Christine Schultz, our senior grants manager, and you will hear we reused her instructions on how to use Found It, kind of an intro to Found It. From a previous RFP, so she may make reference to healthcare providers and others which were relevant to the school-based health center RFP, obviously not relevant here, but nonetheless, this information is very useful in getting to know our grants management system. So hopefully seamlessly launch this.
Looks like it's loading. So while this is loading, Sonia, do you want to share any other pieces that might be relevant for our applicants to know? You're on mute. Looks like this is not working. So why don't we just continue on and we can share the link and grantees can watch it or applicants can watch it at a later date. Does that work, Michelle?
Yep, good plan.
We will share this as part of the process for applying. Okay, so this is the timeline that you will see in the RFP packet, but we just want to be really clear on the dates and how this process will go. So this webinar is available starting May 19th. You can view it anytime. We want everyone to apply by 5 p.m. on July 6th. So that is the final deadline to submit your application. Our team will work on reviewing all of those applications, and Sonia will reach out to each of you if you are selected for a site visit. So our team will conduct site visits July 19th through the 30th. We had been doing virtual site visits this year due to the pandemic, but we do anticipate these being in person. So as you put in your proposed days and times that you're available when you're applying, just be cognizant of our thought right now is those will be in person. And then our team will kind of take all of that data and work internally to award those grants by August 18th. So all applicants will hear whether they were selected or not by August 18th. So our team has done a lot of capacity building and education about recovery housing over the past really 6 months. So we thought it might be helpful for applicants to take a look at some of these webinars that we've done. So back in the fall, we did our first webinar on the recovery housing gap analysis, which was a study Miami University performed in partnership with our team. So that's really interesting. It will help you understand how we chose these funding priorities. Next, you'll see recovery housing and landlord tenant laws, parts 1 and 2. There was so much information, it was broken into 2 webinars, and that applies to Ohio and Indiana. And then if you are in Kentucky, you would want to take a look at the recovery housing and Kentucky laws. Both actually are great webinars no matter where you reside, but just be cognizant of the speakers and their expertise, whether it's Ohio, Indiana, or Kentucky. Next slide.
Great. Again, we thank you very much for participating in our webinar. We're glad that you could be here, and we look forward to hearing from you, reading your applications, and of course, reaching out to us if you have any questions. Thank you.